Hey, this episode was filmed during the COVID pandemic, so for the safety of our cast, everyone is seated 6 feet apart. Also, this series is for information and entertainment purposes only. It isn't intended to be a substitute for professional medical advice, diagnosis, or treatment, so don't delay or disregard professional medical advice based on the information provided. And, as always, if this is a medical emergency, dial 911.
Welcome to Going to Health.
For people, from people.
So this one time,
Oh, I'm gonna go get some tasty waves, bro.
So when it comes to stress and treatment plans for stress, I know it ranges from things that you can do every day, but then, when you're in moderate, unmanageable or like severe, definitely unmanageable stress level, what kind of different treatments do you specialize in, and describe the scope of treatment for stress?
Yeah, so if it's unmanageable and it's a threat to your life, of course, I want you to go see a psychiatrist, right? But if it is unmanageable, but there's nobody's life is at risk, I would probably start with doing breathing techniques in my practice and help the patient just be able to focus and feel what the body is going through. And the NET, the neuroemotional technique, which is a technique that treats what we call neuroemotional complex. So if there is an acute stress, if you're coming into the office, you know exactly the situation, and through this testing procedure, we detect, this stress is actually affecting your physiology. Then we go through this NET process, which is a combination of, like I said, semantics, using words, and checking the congruency of those words with your body. So with that, we find a stressor, we find the one situation, connected to a particular emotion. So it's actually connecting the emotion with the stressor and then bring you back to that stress situation. We have meridian points, acupuncture meridian points in our pulse, related to different elements and different emotional points. So you connect the point, you touch your forehead as you're bringing up that stressful emotion, and you just breathe deep. The problem with emotions, they become a problem if your body is not able to process all the way through.
exactly.
Because you're hitting with emotions every day, right?
Right. If you think about all the stuff that you worry about, and then it turned out okay.
Yeah.
So I think that people need to think about that. They say 10% is what's given to you, and 90% is your attitude.
Right.
And you really have to think about it.
I do think that there's a space for people that are unable to manage their stress because there is such a significant amount present in their life, and it is a complete deteriorating situation for people to be in, and it affects their physical well-being, their psychological well-being, and certain experiences or traumas, right, can really
exactly.
put people into or loss or grief, right, and they'll come to you looking for different innovative ways to release
Exactly.
stressors, right? And that's
Yeah.
where this NET treatment would come into play when there was a trauma, or do you find yourself working with military and PTSD, or?
Actually, there's 2 years already, 2 consecutive years, and I'm hoping for the invitation comes again. But we've been going as a volunteer to retreat for women that were victims of physical abuse and violence. And it's heartbreaking to see what those ladies went through, but just in the fulfillment of using the technique and having some breakthroughs they have not been able to achieve just by asking the body, just processing it, and being courageous enough to bringing it up. But I don't have a psychology license to do that, but I have a chiropractic license to do NET.
It's so great that in addition to your practice, you're also making a difference outside of your practice. And I think that's another way to alleviate stress, is to do something good for other people.
Exactly.
Instead of just being in our own little world and thinking, oh my gosh, there's traffic, blah, blah. You step out and you say, what can I do to help other people?
That's a great point, Aline.
Right.
I completely agree with you. I mean, I'm lucky enough that my profession, it is naturally that way, but I
Right.
think it's something, instead of like, I'm not gonna think about that, is think about something better, just change the momentum of the emotion or the thought, and just service is one of the more powerful ways of doing that.
Exactly. How do you handle stress?
And my dogs are a big calming source for me.
Right.
I've been a person that was very anxious for a long time. Nowadays, what works really well for me is just I stop when I feel like that there is, like, why am I, there's something there. I ask myself, there's something bothering me. Whatever that is, you know, I'm able to detect.
Right.
And then I always say awareness is power. So
That's
you
it.
become aware, like, and then I even go further. Why is that an issue for me? Why is that triggering me? Oh, because of that past memory or that past reaction in the
true.
past situation. Done.
Yeah.
You know, like, okay, move on.
Right. We have to
Next.
figure out what our triggers are.
Yeah, I think it's
That's
really,
the whole thing.
yeah.
Yeah. And now I'd just like to ask you your final thoughts.
I think the high was more of the NET. I really didn't know what NET was, and I really do appreciate that.
I guess it's my turn.
It's your turn.
Okay.
Haley, what was your high for today?
I loved that the issue is in the tissue. And also, I also, you know, that really stress is about broadening the capacity to manage it. Because you can't ever necessarily get rid of outside factors that are causing you to feel overwhelmed, but you are able to control what you can manage.
Dr. Latufo, what was your high for
Well,
today?
my high, definitely to be able to connect with you guys and just hearing, you know, your experience with stress and us relating and finding solutions.
Exactly.
And of course, just spreading the word that if there is a will, there is a way, and there is techniques out there that we are there to help.
For those of you who are in Southern California and you want to connect with Dr. Latufo, can you please give us your information?
Yeah, well, I'll be happy to be a resource for any questions. My website is lineachiropractic.com, and the NET, there's a resource for a director for doctors at their website is netmindbody.com.
Great. Thank you so much. Thank you, Carlos, Haley, and Dr. Latufo. We come from different walks of life, and yet we've learned so much from each other, so thank you. They say the road to hell is paved with good intentions. We believe the road to health is paved with good information. Thank you for joining us on this quest to alleviate stress and anxiety. We'll see you next time on the road.